Hello everyone, so today's video is about differences between SOM and ASOM. Before learning the differences, let's know about what is SOM and ASOM. So SOM basically is secretory otitis media and ASOM is basically acute suppurative otitis media. So the first difference lies in the causes. So SOM basically is non-infective. It means although there is the discharge in secretory otitis media, the discharge will be sterile. It means there is no pathogenic, evidences in the discharge. But on the other hand, the ASOM has infection going on, and the causative organism for the infection is S. pseudomonas. Okay, which is a bacteria. Now we'll learn about the signs and symptoms in SOM and ASOM. So basically, SOM is non-infective, so there won't be any traces of pain, fever, but there will be conducting hearing loss. So conductive hearing loss, or you can say CHL, will be seen in SOM. On the other hand, ASOM has infection, so it will accompany with fever, pain, and conductive hearing loss, which is SCHL. So CHL is common in both SOM and ASOM, but pain and fever will only be present in ASOM because it is infective. Now we'll learn about the diagnostic standards of SOM and ASOM. So to determine the actual diagnosis, to get to the diagnosis, we need to do some test, and the signs we see in the test is basically air fluid levels or air bubbles when it's the case of SOM. So when they mention about air fluid levels present in the investigations, or the presence of air bubbles, the direct hit should be suppurative otitis media. On the other hand, ASOM being infective will show a lot of pathological changes, which include retraction of tympanic membrane, cartwheel appearance on the tympanic membrane. You can see here the image of cartwheel appearance, which is because of the vascular, arrangements, which is because of the infection going on. This is not normal. So whenever there will be vascular arrangements like this, like a cartwheel on the tympanic membrane, you'll get to the diagnosis of ASOM. And along with that, we will have pulsatile otorrhea, lighthouse sign. Lighthouse sign is basically a perforation in the tympanic membrane along with a otorrhea, which means that along with a basically discharge. So it is a perforation along with a discharge, which is called as lighthouse sign, which is also a diagnostic factor. Basically, you can say the sign which confirms the diagnosis of ASOM. Now we'll go towards the investigation which we do. So the investigation is tuning fork test, audiometry, and tympanometry, which is IOC, investigation of choice for serous otitis media, secretory otitis media. But on the other hand, ASOM we do not need any specific investigation as such, which we can say that it is investigation of choice for ASOM. Okay. Now we'll come to the discussion of treatment part of the SOM and ASOM. So for SOM, since it is not infective, we will opt for wait and watch for 12 weeks. You should remember the time period. After that, you should not wait. If even after 12 weeks of observation the disease is not going, you are supposed to opt for the surgery, which is in ASOM, myringotomy with grommet. Okay, and along with that, we are supposed to do the treatment of the underlying cause. Also, the myringotomy is done in the anterior inferior quadrant, and the incision we do is radial incision. On the other hand, for ASOM, we do the medical treatment because we have also to deal with the infection going on. So we are supposed to give the antibacterials or the related, medicine. Along with that, surgery. There are specific indications for surgery. If those indications are fulfilled in the patient or the subject, we will opt for the surgery. And the surgery involves the myringotomy. The position is posterior inferior quadrant of the tympanic membrane, and the incision we give is the curvilinear incision. So thank you students for watching. This is all about the differences and the details about SOM and ASOM. I hope you like the video. If you like the video, do share, subscribe, and like my channel.